Hello, I'm Gerald Lewis. Alzheimer's is a very hard disease as one watches a loved one's mind slowly deteriorate. And although at the moment we don't have a cure, there are a number of things we can do to slow down the progression of the disease and also to improve both mental function and quality of life. And that's what we're covering in this page. It was first discovered by a German psychiatrist about one of his patients in 1902, although the disease has actually been known since Greek times. When Monica and I graduated from medical school in 1967, Alzheimer's disease has hardly made its way into our medical textbooks at all. But in the next few years, the incidence has risen hugely, and it's going to rise even more so, particularly as the population continues to age, as you can see from this graph. It's a very distressing condition, both for the patient and especially for the family, because in many cases, in fact, the patient is unaware of his or her disease. Currently, we've got a number of theories about the cause of Alzheimer's disease, but sadly we don't have any answers, and until we get to know the cause, it's pretty hard to get a medical treatment that works, because medicine has few answers. There are a number of drugs, some of which may slightly decrease the symptoms, but actually don't affect the disease progression. In fact, in some cases, stopping drugs, such as drugs like the statins, can actually make a real difference, more so than positive drugs. Lifestyle and dietary changes can make a real difference, and I suggest you look at the section on coconut oil, which we still don't know really much about, but may be beneficial. It certainly can't do any harm. There are a number of nutritional supplements that can help brain function, and I suggest you look at these, especially gut health, hormones, antioxidants, vitamins, fish oils, and ginkgo. Mind, body, spirit, energy therapies, I'm quite sure to make a huge difference, and we should be looking at that a lot more in many of our diseases. It's very hard to actually quantify how much difference it makes, but it's very important. Unfortunately, until we know the cause of Alzheimer's, it's unlikely that we're going to make any major breakthroughs on the medical side. But it's very useful to be able to offer treatments that can potentially make a real difference to the patient and also to make their family feel much less helpless. So I encourage you to read this page, particularly looking at the complementary treatments, and I hope it helps.